Hi, and welcome to the Invigor Medical Podcast, where we're going to walk with you on your journey toward optimal health, performance, and well-being. My name is Natalie.
And I'm Derek.
And we're going to be your hosts on this journey. In each episode, we share insights from top professionals in physical, mental, and emotional health. With that said, let's dive into today's podcast. All right, today we are super excited to introduce Dr. Stephen Jones, who is our new medical spokesperson here at Invigor Medical. Dr. Jones has expertise in weight loss and minimally invasive gastrointestinal surgery. He's also a board-certified general surgeon, and he's joining us today to share valuable insights and tips for achieving healthy weight management. Dr. Jones, welcome to the show.
Thank you for having me. I really appreciate you guys taking the time to speak with me today, and hopefully I can not disappoint and impart a little bit of wisdom and some knowledge about the topic of GLP-1s and Semaglutide.
Yeah. We hope so too. It'd be really sad for this to be your first and only. And we're planning on having a long relationship here.
Yeah, one and done. No.
No, I'm excited for our listeners to get this introduction to you, and because this is going to be an ongoing thing. Derek, you want to share a little bit about what is the role that Dr. Jones is going to be playing with us here?
For sure. For everyone that's been listening to the podcast, you're well aware that we have been spending a lot of time with experts in the field, and we kind of came to the realization that we would like our own in-house expert that can address the specifics of the treatments that we carry, and that can address your question specifically as well. So we're really excited to have Dr. Jones. We had a pretty rigorous interview process to find the right candidates, and we were very impressed with Dr. Jones and his qualifications and his story. So if you have questions for him regarding weight loss, regarding any of the treatments that you have, you can always put those down in the comments, and we will direct those to him and love to get those answers. So that's Dr. Jones. But I don't want to steal his thunder too much. In fact, Dr. Jones, you want to talk a little bit about your background and what really interested you in being here on the podcast?
Yeah. So just so everyone knows, I'm a general surgeon by trade. I spent a lot of time in general surgery and training, getting familiar with just the GI tract in general. That was always kind of my interest. I did do a fellowship in advanced GI surgery where we spent a lot of time doing a lot of weight loss surgery. So my day pretty much entailed doing gastric bypass surgery, doing gastric sleeve surgery, and these were all pretty extreme, operations in order to help individuals lose weight. And they go through a very intensive monitoring program prior to surgery, where they have to go through psychiatric testing, a lot of metabolic testing. They need to be tested to make sure that they are just right kind of for the operation. And then, of course, they spend, time in the hospital going through the actual operation and then the recovery process. And it can be very taxing, on the human body. There are a lot of things that can come up, a lot of kind of negative things, complications that can come up in the future, which we can talk about, a little more in detail later on. But some of those things kind of really interested me in the world of medical weight loss, because, here's a way that we can really impact patients and their lives and add to their weight loss journey without having to go through such an extreme surgery. Now, don't get me wrong, I'm a surgeon, so I love to operate, but you really need to tailor these for what's best for the patient and not just operate for the sake of operating. So that really sparked my interest into the medical weight loss world, and what a perfect time to be a part of this, because, over the last several years, the evolution of the medical weight loss world has been just truly outstanding. And, I'm really excited about the future and where things are going to head. And who knows, we may be saying goodbye to gastric bypass and gastric sleeve surgery in the future. So that's really kind of what got me into this. And now, seeing that there are so many more options available.
It's awesome to see how much passion you have for this. And, obviously you also, with the passion, you bring a lot of knowledge and a lot of very deep insights on this topic. So that's something that I'm interested to dive into. I don't know, Natalie, based off of his story, is there anything that you wanted to touch on?
No, I think we're going to get into it as we start exploring the GLP-1 therapies, which is literally what we have typed up here on my iPad, because I've had the question too, what you just mentioned about, the gastric bypass and gastric sleeve surgery, and knowing, some of these other weight loss opportunities that are available out there, because I know people that have been through the surgeries and even years later to witness how much their life is still altered,
Yeah.
much of it positive, right? Because of how
Yeah,
much their
of
life has
course.
changed the weight, but also like how much food they can eat and like, and,
Yeah.
and having one drink, one alcoholic beverage and how that, there's all these things that it's like that I had no idea were like this
Yeah.
continuing. So I'm excited to kind of explore those comparisons, which might come a little bit later in the conversation as we dive into these GLP-1 therapies. So I'm happy to take it where you want to go next.
Actually, as we talk about this, I think that one of the best places to start might actually just be talking about like the general approach to weight loss, like who should be considering weight loss. Just kind of address it from the broad picture, and then we can
Yeah.
hone in on more specific
Yeah.
therapies. I think that
Yeah.
might be a good
So,
place to start.
first off, obesity in America is, really is an epidemic at this point. There's estimated that over 40% of all Americans suffer from obesity. Obesity in itself really can be boiled down to a physiological condition, much of which that can add to many adverse effects from a cardiovascular standpoint, from your kidneys to your liver. So all of these things really, really add to the detriment of just the overall, population in America. So when you look at being overweight or obese, we really, in order to kind of classify and be able to talk amongst medical professionals, we look at BMI. BMI really lets us know based off of your height and weight, kind of where you fit in that range. And so as we know, 25 BMI is considered overweight, 30 is considered obese. Whereas when you think about it, 40% of the American population being obese, I mean, that is a really significant number. So really, we look at these numbers and we decide,
Yeah,
hey,
it
based
really
off of
is.
these numbers, these are the people who really should be considered some sort of, weight loss, therapy or weight loss program in order to become, more healthy and get rid of a lot of those metabolic conditions that really plague our population.
Yeah, for sure. And obviously, like the go-to methods are the things that people have heard time and time
Sure,
again, right? Lifestyle factors,
sure.
exercise, diet, those kind of things, controlling those
Yeah,
factors. And so, but for so many people, like they try those things and it's either an adherence thing, and there's so
yeah,
many variables to take into consideration, like someone's
yeah,
hunger signals, how much calorie so they burn just like doing nothing during the day. So like
sure.
for each person, it can be so different. But I guess this kind of gets us to the point of like, GLP-1 therapies, which GLP-1 just stands for glucagon-like peptide. And maybe we can
Peptides,
dive a little
correct.
bit about that specifically, like what that
Yeah,
actually means. But
yeah,
that includes, Ozempic, Wegovy, Saxenda,
sure.
Mounjaro, like all these things, the generic names being which
Yeah,
liraglutide, semaglutide, or semaglutide, depending on who you talk to, right? Or
yeah,
tirzepatide.
yeah,
Let's talk. Let's go ahead and dive into those. Like,
yeah,
tell us a little bit about the history of these medications and who are they
yeah,
good for?
yeah. So the GLP, like you mentioned, stands for the glucagon-like peptide. Now, this is actually a native peptide that naturally lives, within our gut. It lives in the intestinal cells in our gut. And the way that it kind of works is after you consume a meal, the food travels down your swallowing tube, goes into your stomach, mixes with the acid, starts to break down, and then these signals are released into the gut, and it causes the actual L cells to release the GIP hormone. These hormones are what you may hear, they're called incretin hormones because what they do is they specifically target the pancreas, and it allows the pancreas from the beta cells within the pancreas to release insulin. And as we all know, insulin is the major hormone in glucose regulation. So when you release insulin, it causes your blood glucose levels to go down. So that's really how these medications kind of were founded and how they started. They were really to regulate, and treat diabetes. But what they found in treating these diabetic patients were that they were getting amazing results in terms of weight loss. So as a result of that, then multiple studies began to come out to really show the true benefit of the GLP-1s, not only as glucose metabolism, but also treating obesity. So that's really how this came about. Initially for diabetes, but they found that also you get really extraordinary benefits in terms of weight loss.
That's incredible. That's incredible. And so just to break that down and summarize it in simple form, GLP-1 medications, glucagon-like peptide, removes blood or it lowers blood sugar, which has
Correct.
a lot of really great implications for diabetics, right? Because blood
Correct.
sugar is the name of the game with diabetes. But
Yeah.
in terms of actual weight loss, is it the removal of the blood sugar of the sugar from the bloodstream that actually does the mechanism for the weight loss, or is it something else?
Yeah, so it's really multifactorial, to be completely honest. The GLP-1 receptors in our body are kind of all throughout our body. And as we sit here today, I mean, there's still more and more research being done to really, really understand the total effects of GLP-1 in our body. But from what we know now is that, the majority of the effect happens within the pancreas. It also happens within our central nervous system, which is truly important because that is really where the appetite and satiety really comes into play. We do know that people who are on these medications, semaglutide, it does truly affect their central nervous system, which allows a decrease in the appetite and increases their satiety. So these people, after they eat a small portion, they get full much quicker, and their appetite is suppressed. So not only do you get the decreased blood sugar, you get the appetite suppression, you get the feeling of full much quicker. And then it also has an effect on gastric outlet. So I'm sorry, I'm going to a bunch of different subjects at once.
No, you're
so
just
please
fine.
stop
Yeah.
me. But our body basically has a function. So once you consume food, there's a little muscle at the end of the stomach that closes. It allows time for the food to break down. It has a certain amount of time that the food mixes in the stomach and then it exits into the small intestines. Well, we know that with the GLP hormone, that it causes food to stick around in the stomach a little bit longer. So you decrease the amount of food that enters into the intestines at a rapid rate. So those patients tend to be less hungry. So the GLP effect really affects a lot of different areas of the body, but those are the main ones that we are aware of now.
Awesome. So the slow gastric emptying, right? It creates like this sensation of fullness. Is that just because it's sticking around longer, and so it's like literally like a pressure in your body that's just like, yeah, I'm not full, or is there more to it, like a neurological or chemical effect to it?
Yeah, I mean, it's a little bit of both. I mean, from a restrictive standpoint, when you think about it, like after Thanksgiving dinner, after you have a huge plate of food, you're just stuffed, you can't really move. And that's really, kind of the same principle behind the GLP-1s. I mean, you're going to have food that's going to sit there much longer. So your body is going to think, hey, I'm full for a longer period of time. So you're not going to have that, the appetite for more food, which is truly a benefit.
Yeah.
Yeah. I think it's really interesting to kind of hear it broke down, because I think anybody who's been paying attention at all has seen such a rise in these peptides and understanding what the differences are between them and what they're actually doing in the body. So I know that Derek kind of had it broken down here a little bit and diving in. I know we've kind of already gone into semaglutide a little bit, but did you want to start with, is it liraglutide? Is that what we're calling it?
Yeah, I mean, maybe, so I guess it really depends on who you talk to. I've heard it so many ways, and I feel like this is just something that in the scientific community is like, you have one word, potato, right? There's so many different ways to say it, but like liraglutide or liraglutide. I think
Yes.
most people, and what I prefer is liraglutide or semaglutide or tirzepatide, but depending on where you're at, you might say it differently.
Yeah.
But I don't know, maybe we can touch a little bit about like, how were these? I mean, we already touched on that they were initially developed as a diabetes medication, but maybe we can talk about what the actual differences are between liraglutide, semaglutide, and tirzepatide.
Yes, I think that's important because people hear so many different conversations around what these are, and then oftentimes they'll have the name brand, right, like Ozempic or whatever, and so there's like a lot of confusion. And I think it's really important for people to understand the differences because I think that we're living in an age where advocating for your own health is super important, right? We want to rely on doctors and their expertise, but also it's important for patients to have a sense of ownership in their own care and like understanding what the options are out there so they can go and have informed conversations with their doctors. Because I can just imagine like going and sitting with the doctor, like all of these possible things it could be, but like you don't have 3 hours to like here's all of these and here's how they work. So if a patient comes in with a little bit of knowledge to be like, okay, I feel like these couple of things might be it. Let's dive into just this. So I like the idea of going through these peptides and kind of explaining what the differences are and how they operate differently in the body, and even maybe what the difference like could be in the effects that they have in the body.
Sure. Yeah, so these the way I like to think about it is that these are all kind of different generations of the same drug and mechanism. Just like with anything, liraglutide was really the truly one of the first GLP-1 peptides that came out. So as you can imagine, with anything that's early in the developmental stage, it's not going to be quite as good, so to speak, from the newer GLP-1s.
Sure.
So for example, with liraglutide is one that you have to use more often. So as opposed to a lot of people know about the pen, the injections with the pens that you have to take once a week. Well, liraglutide was one of the ones that you had to do daily.
Wow,
And
that's a big difference.
And that's mainly, and a lot of it has to do with the biochemistry of the actual polypeptide itself, which we won't need to get into.
And like the
But
half-life.
the way that this kind of works is that the GLP-1 just in general has a very, very short half-life. So scientists really needed to figure out a way to make sure that when they administer the GLP-1, that it would actually stick around and be able to be efficacious to patients for an extended period of time. So liraglutide was one of the first where they figured out a way to keep it around a little bit longer. And I believe the half-life for liraglutide, which is the amount of time that half the concentration of the drug is within the systemic circulation, is about 12 hours or so.
Okay.
Okay. So with that, you can imagine that you would need to kind of redose yourself every day with that in order to get the maximal effect. As you get further down the generations to semaglutide, to tirzepatide, those medications their half-life is much longer because scientists have kind of figured out a way to keep the drug in the systemic circulation a little bit longer. So that's really where the differences in the medications come into play. But liraglutide was kind of the first on the block and really set the foundation for the other ones, if that makes sense.
That does make sense. And do they, if you're taking one of these medications, do they like hang around in your body even for a time afterwards? Does it take time for your body to move all the way through it? Or is it like if you miss your weekly injection, like you're already like done, like it's not operating the body any longer?
Yeah. So, I mean, the concentration of the drugs are going to be the highest, after administration. They kind of work on almost like a bell curve. And then once you reach the half-life, then it starts to slowly taper off. So you can imagine if after so many half-lives, you're going to have no concentration of the drug in your system. So you're essentially going to be starting from scratch if you miss a couple of days. So that's really the true benefit of the next generation, with semaglutide, and that you only need to dose the medication, once a week, because the half-life of the drug lasts for like 160 hours or something like that, which is, basically a week.
Hang on. I had a thought. I was just going to ask, oh, it was about dosing. Sorry, I'm like trying to keep up with all the questions rolling around in my mind. Does it also matter like how much is being dosed? Because I know, oh God, it's been probably 2 years ago. I did a round of semaglutide when I was having some health issues and like needed help, like getting like put on a bunch of weight for no reason, was trying to figure out some gut issues. And I was like, I just mentally need a little help to get past this point, because it was like, honestly, just depressing how poorly all my clothes were fitting. But the way it was set up was like the dose was gradually increased over a period of time. And so I guess I'm not even quite sure how to frame my question so much as how does dosing work in that regard? And is it normal to like, maybe some people need a higher amount or some people need a lower amount, or you taper it up for a specific reason?
Yeah, I mean, and you really need to tailor specific to the patient or client. I mean, to be honest, some people have a great effect with the minimal dose, and some people require a higher dose, just kind of depending on your body's metabolism in general. And then you also have to look at the safety profile and the side effects, because obviously if you're at a higher dose, you may have, more of the side effects that are associated with the medication with the higher dose. So it's really a tailored approach with the medication. If you find that after, a couple of months, hey, I'm just not where I want to be from a weight loss standpoint, based off of the medication profile, then we may need to increase the dose to get you to where you need to be. So it's really a tailored approach that each,
that makes sense.
practitioner needs to take in account.
And so that's trying to find the right dose, because in medicine in general, we're always trying to look for the minimal viable dose, right?
Correct.
Like this
Correct.
is the amount that's going to get you the results that you're looking for, because that's also what helps minimize the number of side effects that you get. Maybe we can talk about some of the common side effects of semaglutide and what people can do to essentially try to counteract those, because I've heard a lot about the different side effects, which can be a little bit embarrassing sometimes for people.
Yeah. So, I mean, kind of like you said, I mean, if you look online, you Google, you YouTube, whatever, you'll see the pros and cons of, these medications. In my opinion, the pros far outweigh the cons for sure, but you can have some side effects. And the biggest side effects, as you can imagine, typically come in the form of GI upset, basically. These drugs are specifically working in the GI tract. So you are going to have some GI. As I mentioned before, one of the, major keys of the drug is that it slows down the outlet of food from the stomach. So if you can imagine, if you're having more food kind of sitting around in your stomach for a longer period of time, it may give you the sensation of nausea. You may get some vomiting. Some of these medications increase the motility. So you may get increase in passage of stool through the GI tract, which could lead to diarrhea. So the major impact that it has is going to be on the GI tract: nausea, vomiting, a little bit of an upset stomach, some diarrhea. There's been some other rare cases of pancreatitis, which is like inflammation per se of the pancreas, which can cause some pretty severe pain. That's very, very rare. And then there's one warning that if there's any history of thyroid cancer in the family, that you have a personal history of thyroid cancer, then you should not take the medication. And they've seen increase in thyroid cancers in some animal models, not in actual humans, but because of that, they've had to mention that. So you may hear, if you watch any of the commercials, they'll mention something about medullary thyroid cancer. So.
Hey, I hope you're enjoying today's podcast. I just wanted to take a quick break because if you're listening, you probably know what we do here at Invigor Medical Podcast, but maybe not what we do at invigormedical.com. So let me introduce us. At Invigor, we provide prescription strength treatments and peptides for weight loss, sexual health, and lifestyle optimization. Every treatment plan is carefully prescribed by licensed doctors and sourced from legitimate pharmacies. You don't ever need to buy questionable research chemicals again. And bonus, as a podcast listener, you get a 10% discount on your first treatment plan with code podcast10 at invigormedical.com. Now, let's get back to today's episode. Well, but all that being said, I think obviously it's important to be aware of side effects, and, everybody should be aware of things like that before they take any kind of medication,
of course,
right?
Yeah.
Sure.
But, thinking about it in comparison to these much more extreme weight loss surgeries that we've done historically in the past, those also come with their own risks and side effects, right? And many of them long reaching, like what I mentioned about, and you could speak to this at a higher level. So
Sure.
I think it's just, when it comes to, people trying to find a way to get out of that obesity category, right? And I've thought about before, I just wonder, it's so interesting thinking about how we've changed physiologically as a human race due to the industrialization of our food.
Yes.
And, thinking about, we talk about it being genetics oftentimes, and either there's different schools of thought on that and whether or not obesity is genetic. And I don't necessarily want to get into that per se, but I did start thinking, wondering, what?
Maybe a future episode.
Yeah, but I did have the thought of maybe not that it's a genetic predisposition necessarily to obesity, but maybe that genetically the predisposition is to be intolerant to the way that our food products are now interacting with our bodies, right? Because food is just not the same. And especially if you don't have the education or don't have the access to healthy foods for the first part of your life, it's like now there's just this chain effect of events that has been kicked off, that now it almost seems like you just can't get in front of and get on top of at, your 30s, 40s, 50s, whatever beyond now. And now it's this massive thing. And so now it's no matter what you try, the chemical makeup of your brain and your hunger cues and your satiety cues and the foods that you crave crave and how quickly you're able to lose weight so that you can actually feel encouraged to stay on the path that you're on.
Like how hyper palatable food is nowadays
right.
as well.
And so you just want more and more. Right. Yeah. So in that sense, I think that it's important to have some empathy, right? Because I think that people, especially if they've never really had an issue with weight to a large degree, you know, pretty much anybody you talk to would love to lose a few pounds at least, right? There's very few people you meet that are like, oh yeah, no, I wouldn't love to lose a little bit of weight, 5 to 10 pounds, whatever. Yeah. But unless you've ever really struggled with having to lose 50, 75, 100 plus pounds, there can oftentimes be an attitude of, well, just get off your butt. Like, well, just don't drink that soda. Just don't do this. Just go for a walk. And the just is so minimizing. And there's not an understanding of really what so many people are going through and trying to find the best way forward to get out of that obesity category, right? And so I think that's the really cool thing about these conversations. And obviously there are people that, you know, utilize, me being one of them, these peptides, you know, for weight loss that are not in the obesity category. And I don't want to say like, shame on you, you shouldn't do that. Hell, I'm one of those people, right? Yeah. But as far as this conversation is relating to, you know, your background with these more extreme interventions for weight loss for people with obesity and how that translates to these peptides, thinking about there being an option that is so non-invasive comparatively and really is having incredible results, I think is just really amazing. You know, it is. For these people, it feels like hope.
It is, yeah, for sure. And just to piggyback off of something you mentioned earlier about the genetic predisposition, I do a lot of gallbladder surgery, and gallbladders in general, you know, removing gallbladders is not really a genetic, you know, there's really not a true genetic disposition to gallbladder surgery. But I run into patients all the time who, you know, come up to me and say, oh, you know, my grandmother had their gallbladder out, my mom, my aunt. So all the women in my family have their gallbladder out. And it really just speaks to the kind of the paradigm that we're kind of locked in. So, you know, families, they tend to eat the same. So it's not per se that, hey, the gallbladder is the bad, you know, is bad. It's to say that, hey, you guys all kind of eat bad. So it's going to make sense. It's going to make sense that you all are going to get to see gallbladder issues. So it kind of speaks to the same thing. I mean, a lot of this is, you know, not to make light of the situation, but it is in a sense, kind of a mental disorder in a sense. And the fact that, you know, a lot of people have this just mental hurdle, mental block with eating, the way they eat, how they eat. And it typically is just transferred down from generation to generation to generation. So, you know, trying to stop that is really, in my opinion, is going to be the key. These little adjuncts that we have available, you know, with the medical weight loss and surgical weight loss, those are helpful. But in the long run, it's really going to be, you know, stopping the source, so to speak.
Yeah. Maybe we can dive a little bit deeper into that, because like, just like you're saying, you know, what semaglutide does is it offers an opportunity for people that struggle with losing weight. It kind of gives them hope in a situation to do that. It also allows people to, you know, like eat less and I think actually be a little bit more thoughtful about what they're eating, right?
Yeah.
And because in the long term, like what we want to avoid is like a yo-yo diet where someone is on the medication for 6 months and then they get off of it and then they just return back to their old habits of eating and then they just put it back on again and then go back on the medication and go all over again because, you know, like at least here at Invigor Medical, we don't necessarily want people to just keep on coming back for the medication. We want people to get the medication and like get off of it and be able to maintain a good, healthy weight. And so I think that a big part of that, I guess, maybe we can talk a little bit more about these mechanisms is like, you know, you reduce the amount of food that you eat, but that comes with its pros and its cons of like, if you reduce the amount of food you eat, if you're still eating junk food, you know, you're not necessarily doing yourself any favors. Whereas if your appetite is reduced and you're able to then say, okay, I'm going to use this reduced appetite to try and be very conscientious about the foods I'm putting into my body. Maybe we can talk a little bit more about that.
Yeah. Also, to piggyback off of that, I think a lot of people don't realize that a lot of the data that we have from, you know, the GLP-1s and the semaglutide, and the studies that were done to really prove all of this, that these individuals who were studied, they were put through an actual program. So it wasn't like they were just getting semaglutide injections weekly. No, these people, they were actually dieting. They were forced to do they were forced to exercise. So, it was an
That
entire
sounds
program.
terrible.
It wasn't just a quick fix of an injection,
Yeah.
daily
Yeah.
or weekly. So keep that in mind for sure, because again, if you form a habit, it doesn't take, what they say, 2 weeks or so to form a habit. Once you form the habit of exercising, dieting, trying to eat right, it becomes like muscle memory, so to speak. And then you can kind of continue that on for the long term and not have, the yo-yo effect that you're mentioning.
Well, and not to use a term that can oftentimes kind of have a negative connotation, but I honestly kind of think of it as like a crutch. Like if you suffer an injury, you break your leg or your ankle or whatever, and you need to heal, right?
Yeah,
If you just try to start walking, running on that broken ankle or leg, you're probably going to re-injure. You're going to have a really hard time, feel defeated, and
correct.
just not want to get up and do it. However, if you have a crutch to help you, you start building the muscle to be able to get through that healing so that you can eventually drop the crutch and do it on your own, right? And that's kind of how I think of these peptides in my mind for that kind of thing, is like if you're using it intentionally and hopefully having some coaching or, to help you get through it, then the thing is like when those cues that have been around for so long for what you're going to eat and when you're going to eat and how you're going to eat it, when those are helped by having these peptides, if you intentionally say, okay, now I'm going to start getting rid of this food, clear out the food in my kitchen and in my pantry, in my fridge, get it out of there. I'm going to introduce these things. I'm going to start learning these recipes while you have the wherewithal and the willpower to start investing in these ideas and these practices.
Yeah.
So that eventually when the crutch of the peptides that you can wean off of that, you've done that really, really hard work, because one of the hardest things is to get all the junk out of the house, start thinking about food differently, learn
Yeah.
new recipes, try new foods, get your taste buds kind of used to those things. That's really hard stuff to do. So
It
if you
is.
can have the help of a peptide to get you, running with that, then use the crutch.
Yeah,
I
yeah.
think it's an
And
incredible
the
opportunity.
And the beautiful thing about it is that, while you're doing that, the semaglutide really is giving you positive reinforcement, because you are seeing a difference. You're noticing that you're losing weight. So all
Yes,
of the, all the
it's a
things
good
that
point.
the effects that you're putting into place are working, and you see that. So you continue that motivation to keep moving forward, to keep making the right choices in terms of food and such. So, that's the beauty of the semaglutides.
Yeah,
That's a really good point, because sometimes this issue is like when people get started and
Yeah,
they don't see movement,
Yeah.
right?
right.
Or it's so slow. And unfortunately, we live in a society of like immediate gratification. It's something
Correct.
even I struggle with, even though I've lost, over 50 pounds 3 times in my life between pregnancies and stuff. Like, and so it's still, even though I know how it can, but it's just, well, what the heck? I didn't lose any weight this week, or I didn't this. And then, add in things like you see shows like The Biggest Loser, like Joe dropped 20 pounds last week. It's like, holy
How?
shit.
Yeah.
And I dropped 0.5, or if you're a husband wife going through it and the wife is always like, how did he just lose 10 pounds? Like,
Yeah,
and nothing's moving for me. And it really is kind of debilitating. It's so
yeah,
hard to like stick to these things and to make these habit changes. I don't think I can overemphasize like it's really hard to do. And so
it
having an
is.
opportunity to get a leg up, like, man,
Can
I
be a
use
huge help.
supplements all the time to help me, ketones to help with my energy and to like help if I'm in fasting. There are different things that you can utilize. We got a lot of great technology now to help us
We
be
do.
on a path to healthy living. So I'm really excited for us to get this episode out there and talk about, for people to have more education around
For
what
sure.
it is.
For sure. I think that one other thing that I wanted to touch on as well, that while we're kind of on this topic is, as you're replacing all of this kind of junk food while you're on this medication, I've heard a lot from our staff. We talk to our patients. People, they talk about how bad their side effects are, and they're like, well, what are you eating? And they're like, oh, just all the same stuff I'm eating before, fast food, really oily foods. And it's just like,
Right.
if you're continuing to eat the same foods while, taking this medication, all of a sudden, all this greasy food is just going to be sitting there in
Sitting
your
there,
stomach.
yeah.
And it's like, you're wondering why you're having all these bad side effects. You're having all these bad side effects because you're putting junk into your body and is having to deal with that for even longer,
Yeah,
And so maybe,
Yeah.
I guess, one of the things that I really wanted to address is we talked about what some of the side effects are. And there's one in particular that I wanted to add as well, which is sulfur burps. I don't know if you've
Yes.
seen anything about the sulfur burps, where you burp and it straight up tastes like eggs. You know,
Nice.
like
Cute.
yeah,
Love it.
very interesting. But like, maybe we can talk about what are some things that people can do when they're on the medication and they're experiencing these side effects. What can they do to alleviate the severity of these side effects?
Yeah. No, I think you actually touched on some of them. One is making sure that we are actually making the changes to our diet that are going to be helpful. Like you mentioned, I mean, if you're still eating horrible food, fast food, greasy food, fried foods, those are all going to make all the side effects and everything much, much worse. So that's number one, making sure you're changing the diet, making sure you're getting plenty of liquids. Most people don't drink enough. I mean, that's just the bottom line. Or if they do, they don't drink enough water. So making sure that your body is able to kind of flush itself is going to be very, very key. And then, as we mentioned earlier, depending on kind of the dosage that you're on, you may need to scale back the dosage some, or if that doesn't work, maybe switch to a different GLP-1.
Yeah. So what are there's two particular nutrition variables that I really want to dive deep into. One being fiber and how much of an impact that has on side effects and just general diet and digestion and importance when you're taking GLP-1s. The other is protein, and that one has more to do with making sure that you're losing the right kind of weight rather than just losing weight for the sake of losing weight. Because, like I know that a lot of people, the only metric they look at when they're trying to lose weight is the scale. But like if you're losing weight and a good chunk of that is muscle, that's hugely detrimental to your short-term and long-term health. So maybe we can talk a little bit more about fiber, protein, and then the long-term implications of muscle loss.
Yeah, so fiber obviously is great in terms of gut health and healthy bowel movements. A lot of people don't have healthy bowel movements. A lot of people suffer from constipation, irritable bowel syndrome, and all of that. And most people in
we just did a whole episode on poop. Last week we talked about poop so much on our last episode, so I'm glad awesome. We're touching on it again. Like people, poop is important. I consider myself a poop doctor because all of my patients, my first question to them is, have you had a bowel movement today? That's like my first question for every patient. And we celebrate bowel movement. So that's great. I love it. It's like you got a toddler in the house. It's good stuff.
But honestly, I mean, you would be surprised at the amount of people who have really irregular bowel habits where they can go 4, 5, 6, 7, 8 days, without having a bowel movement and kind of think that that's normal.
I'm just in pain just thinking about that.
Yeah. And like I said, the majority of people just don't get enough, fiber in their diet. Yeah. So it's important to make sure that you are eating foods that are, that do contain fiber. Those are going to be, of course, like leafy green vegetables, things that have a skin, fruits and vegetables, all those things, because those are going to really help with your digestion. Now, if you're not used to fiber and then you all of a sudden go from eating no fiber to a ton of fiber, your body's going to feel it for sure, because you're going to be very gassy, probably going to annoy your partner for sure. You're going to have some fun times in the bathroom, but it's a process, and it's making sure that, again, you're contributing the right foods to your your gut health is truly important. So in terms of fiber, make sure you get your fiber, make sure you're eating plenty of foods with fiber. If you can't do it with food, there's some great supplements that you can use as well. And those are going to be helpful also when you take these medications for sure. And in terms of proteins, like you mentioned before, you want to make sure that, when you're losing weight, that we're not just losing muscle, because muscle is the universal building block. You need your muscle, you need your muscle mass. So it's important to make sure we're losing weight in the right way, which is why I personally, hate all these crazy diets that are out there, which I'm sure we'll talk about at some point down the road. Yeah. But making sure that you're eating a well-balanced diet. And you'll hear a lot of differing opinions on this. But fat intake is important. You need fat. So it's important to know how much fat, not overeating fat, but getting exactly what you need.
And what kinds of fat.
Yeah, your body is going to kind of take what you ingest, and it's going to move it the right way to the right places. But you need to make sure you're doing the best you can to facilitate that it's doing it correctly. So eating a well-balanced diet that's not overly processed, that's really going to be the key. And then in terms of all the side effects from the medications, is like we mentioned before, making sure that the foods that we ingest are going to coincide with the lifestyle that we want.
I love it. And I think this is such a great conversation because I just think so many people have, heard of this as the miracle drug, like that we've all been waiting for. It's
Yeah.
been that thing for the long time, like that weight loss thing that works for everyone, And so
Yeah.
I know that it's kind of talked about like that. And I'm sure you see it in news headlines, Ozempic, the miracle weight loss drug. And
Right.
it's like, in a real sense, it's like, yeah, you could lose weight and change nothing if you take this drug, right? But I think the
Yeah.
point of this
If you get the endorsement from Oprah, then
yeah, right?
you're on to something.
Right. But I think what I love about this conversation is because it's really staying true to what we're all about here at Invigor Medical, which is how to create a healthy longevity, like long life, happy, healthy, all of those good things, right? And
Yes.
at the end of the day, a miracle weight loss drug that doesn't change anything about your lifestyle or your overall health. Because, yeah, not being obese and losing weight is a good marker, but there are plenty of, skinny people who are really not healthy, right? So it's not
Yeah.
the only thing is what's the number on the scale, right? So, we're just emphasizing on this episode, like these are a great tool to have in the toolbox, and they're, not the magic wand, to
Yeah.
just change, like this is going to fix everything. And it's like, no, this is, we want this to be a tool for you to have a better lifestyle and to have
Yeah.
health and longevity. And so I think these are just such great topics that we've covered so far. And I know that there's probably a lot more we could go over.
Well, to kind of transition and utilize that as well, like talking about the different metrics that people can use to actually track health and things along those lines. I think that one of the big things, and this is the key metric for even qualifying for semaglutide, is BMI, right?
Yeah.
Yeah.
And I feel like BMI gets somewhat of a bad rep for different reasons, right?
Yeah.
It's a useful free tool where people can kind of get a general idea of like, am I overweight? Am I obese? But you have different demographics that where it skews. For example,
Right.
I'll use myself as an example. I am technically obese. You wouldn't be able to look. I guess. I mean, I could definitely.
I would not think that.
I could
the
definitely.
Cabra does add 10 pounds.
It does. Yeah, but I could probably use to lose a few pounds. But like,
Sure.
if you were to look at me, it's very skewed. And so like, I think that really for me, the best metrics for my health is body fat percentage, really, truly body fat percentage, because that's the thing that I'm trying to lose, not decrease my
Right.
weight, because I'm happy with my body image. I'm happy with the
Sure.
functionality. My general health is pretty good. And I think there's quite a few people that are in this same boat, especially when you start getting into like bodybuilding communities, people that do a lot of resistance training and have a lot of muscle mass. And so I don't know, maybe we could talk a little bit about using body fat percentage rather than BMI
Yeah.
as like a good indicator of health.
And maybe
Yeah.
it's taking a moment to explain the difference,
Yeah.
right? Because not everybody may have an understanding of like what BMI is and what is body fat percentage. So
Yeah. So I think, you really hit the nail, there when you describe the BMI, because like you said, a lot of people's body composition is different. Men carry weight differently than women. Men's weight tends to be more kind of a central weight. So we carry a lot of weight in our torso, abdomen, women more so in their extremities. So when you may look at someone and say, hey, this person, doesn't really look obese, but in terms of their BMI may be close to 30. So,
Yeah.
BMI doesn't really take in kind of the full picture. It doesn't, kind of talk about certain demographics. It doesn't talk about certain genetic predispositions. It just kind of gives you a broad overview. So just so when you're having a normal conversation with someone, they may be able to, okay, I understand this person is, their BMI is 27, so they may be a little bit overweight. So that's really the key in BMI. It's just kind of an easy standard for us to use to kind of look at patients and kind of characterize patients. When you look at percentage of body fat, that gives you kind of a better indication of the amount of body fat that a person has, and then based off of that, you can kind of tailor that to determine, hey, this is how much you should lose in terms of percentage of body fat. So it just kind of gives you a better overall just composition of a person's overall physique.
And then also thinking
Yeah.
about visceral fat, right? Which is the fat
Correct.
that's like packed in around your organs, which it's like
Correct.
comparatively how much visceral fat to body fat also is a big indicator of like how healthy you are,
Yeah.
right?
Correct.
Yeah, which if you have
Correct.
a lot more visceral fat, that's not a good marker.
That's not a good thing. I mean, if you think about it, I mean, you have all of this fat just kind of sitting on your heart. You know, your heart is, you know, if you're overweight, you have this fat sitting on your heart. Your heart is having to overcompensate for that, and pump out against a lot of resistance. It's going to be very difficult, and that's where, you know, the obesity and cardiac effects, you know, to obesity. So, you know, it's bad for certain to carry, you know, a lot of your weight centrally, or the visceral fat.
Well, maybe this is like kind of a tangent, and I know we're running out of time, but now I'm curious because I've always wondered, like, how does that work? Like, were you getting just like fat around your body versus visceral fat? Is it something that like you may be more genetically predisposed, or is it like you fat that's been hanging around for a really long time and we haven't lost, now it gets stored there instead, it gets moved there? So like, how does that work? Can we do like a little thing there?
Yeah, so there's a lot of differing theories on this in general, but in my opinion, this is really a genetic predisposition. This
Okay.
one, I think a lot of people, if you lose weight, gain weight, lose weight, you tend to lose and gain weight in the same areas. The stubborn areas that just won't go away. I mean, unfortunately, that's just, you know, that's just where it is. That's where your fat is stored, and
You
that's
just
where it's going
meant
to
to
come
have
off
a
at the
big
very
booty. I'm just
at the
kidding.
very end after you lose, you know, all of your
Right.
muscle mass. Then that fat will finally come off.
Yeah.
So, you know, unfortunately, you know, there's really no way. You can't really tailor, you know, you can't do a certain workout to lose fat in this area.
Right.
Like that's not really a thing. You're going to lose weight in the way that your body loses weight, and you're going to gain weight in that same way. So,
Yeah. You know,
unfortunately, that's just how it is.
so another thing I wanted to touch on, and I want to be cognizant of time here, but I think we'd be remiss if we didn't talk about like Ozempic face, Ozempic butt, and actually, and this kind of ties into something we've already talked about to a certain degree, but losing muscle mass while on semaglutide versus losing body fat percentage can result in these things that you look somewhat unnatural. And the way that I've talked to my staff about it is like becoming skinny fat. You know, like you lose weight, but like if you don't actually lose the fat, then it's like you're just like this really skinny guy who has more body fat than you have muscle. And like that's not a result anybody wants either. You know, everyone that wants to get on this medication, they want to look good. And so at that point, what do people need to do in order to avoid, you know, the dreaded
that is a
skinny
great
fat?
point, because we see that all the time in our surgical weight loss patients. You know, these patients, they lose weight pretty rapidly, and you know, then they carry around a lot of excess skin, carry you know, their bodies kind of just look unnatural, and then they have to undergo a lot of kind of cosmetic surgery in order to, you know, nip and tuck some things here and there. So it's the same way. I mean, you know, this is more of a journey and process as opposed to a quick fix. You know, you have to do all of the things that someone who's not on Ozempic or, you know, semaglutide is on in order to create the effect that you want. So that again goes back to what we've been talking about this whole time, is making sure you're eating healthy, making sure you're eating the right foods, making sure you're working out, keeping the areas toned that you want toned, and
Would you say
focusing on
resistance training is it really important for that?
It is super important for that, because these all go hand in hand. Like I said, these all kind of work together to get you to the place that you really need to be. You know, it's not a miracle drug, it's not a quick fix. It's all about creating the right lifestyle, the right habits to direct your, you know, your weight loss journey. And doing so, you'll get the body that you want and the habits that are going to, you know, serve you well, not only in weight loss, but just in life in general.
Awesome. There's one last thing, and I know that it's, but I think that this is almost one of the most important questions that I want to ask, because this is, I think, the thing that I've gotten asked the most from patients is, do I have to do this forever?
That's a good one.
If I start taking this medication, do I have to do this forever, or is there a way to taper off? Is there some sort of treatment plan? You know, to figure that out?
That is a great question, and we are still trying to figure out the answer to that question. Number one, you know, all of these are still relatively new medications. Number one, so we don't have a lot of long-term data that would let us know. The data that we do have is only from a few years out. And what we found for sure is that once you do stop these medications, if you're not changing your habits, if you're not changing the lifestyle and the diet, you will gain that weight back 100%. Okay. So if you're one of the people who just kind of take the shots, and then you stop, you're going to gain the weight back. And you would be one of the people who are going to need the lifelong, medications. If you're one who's really, really focused on creating that healthy lifestyle, and you're using this really just to kind of supplement your weight loss journey, those we think are going to be the people who are going to be able to maintain the weight loss.
Yeah, that's great. And so just to put this out there as well, at Invigor Medical, we offer, different phases of treatment for this. One of the phases that we include is a stabilization dose.
Nice.
Where when people have reached their goal weight and they say, okay, I'm really comfortable with where I'm at, I don't want to completely just go cold turkey from the medication, they can step down to a lower dose where then they can kind of just play with it. It's like, okay, I'm not getting as much of the effect from the medication. I can figure out kind of my own natural signals a little bit where they come through a little bit more and I can manage it, but then, not having the full effect of the medication, and then eventually be able to completely go off of it and have the chance to put themselves to the test of did my habits stick? Am I able to continue to maintain this healthy lifestyle that I've tried to gain through the use of medication?
Super smart.
Yeah. I think that is key there, because like you said, quitting cold turkey, anything is going to be very, very difficult.
Yeah.
So being able to have that kind of as just, to kind of help you and push you along to keep you on the right path, I think is going to be key, and making sure that people are able to maintain the weight loss that they want.
That's incredible. Awesome.
This has been such a good episode.
It has.
I'm really excited for people to hear all of this information, and because I think it's hard to find. It's not hard to find information, but it's hard to sort through everything, right? And especially with something that's been so sensationalized as these peptides have. It's just crazy out there. So I'm super excited for our listeners to get some more detail and some more answers. And, like Derek mentioned at the beginning, if you're listening to this episode and you have additional questions, we want to hear from you. The cool thing about Dr. Jones, I had to do it once, like to give him Indiana Jones. But the cool thing about having Dr. Jones with us is that he's going to be recurring. So, questions that we get from our listeners, and what is it that you're wondering, did we answer everything in this episode? Are there things that are still lingering in your mind? Being able to comment those, whether it's on YouTube or Apple Podcast or whatever, gives us the opportunity to come back with Dr. Jones and address it at a higher level, or things that we missed, And I'm really excited for our listeners to have that opportunity, because even though we will have some guests return, it's not with the same immediate availability as we'll have to Dr. Jones.
And also to let the audience know, some of the episodes that we have lined up currently, where some of the topics we're going to cover are just popular diets, deep dive on the Mediterranean diet, deep dive on the paleo diet, deep dive on the keto diet, deep dive on the carnivore diet, right?
I'm excited
all of
about
these
that
things, and another one that I'm really excited for in the future is even having one about body dysmorphia and things along those lines. What can you do to increase body image and make sure that you're not thinking about this in a pathological way? So I'm very excited.
Me too.
If you have any questions about any of those topics, feel free to shoot them our way, and we'll be happy to discuss them here with Dr. Jones. Thanks for tuning in to the Invigor Medical Podcast.
If you enjoyed today's episode, you can support us by liking and subscribing.
Your feedback matters, so feel free to share questions or future episode ideas in the comments section.
For more information about our prescription strength treatments for weight loss, ED, and overall wellness, all from qualified doctors and reputable pharmacies, visit us at invigormedical.com, and don't forget to use code PODCAST10 for a 10% discount on your first treatment plan. Until next time, stay well.